able to put so many vulnerable people in motels, but we didn't, we were nervous, like, then what are we going to do? What are we going to do? Well, now we're at that, what are we going to do? What are we going to do place? And there's lots of energy around working towards better solutions. So I'll just use a couple examples just to pique your interest. And then when we have our own meeting, we need to really wrestle through as a team, especially with the folks that are doing the boots on the ground day-to-day meetings with folks that need our help, what our project should be. But it was interesting to me that a lot of folks experienced what I believe Megan mentioned, was that some of the people that are still in our hotels are people that are really ill. They're elderly people, and they have a chronic illness. And so, yeah, that's a homelessness problem, but it's likely that some of the folks we helped might need a much higher level of care now that they have both a serious illness and they're elderly and they've been homeless. So again, it gives us an opportunity to kind of look at what have we learned with this last project, and what should we be working toward? There are lots of energy around working with landlords about, having a particular unit with a 2-bedroom unit might have separate leases for the bedrooms and stuff. So again, this is an opportunity for us to develop some solutions with the help of some very knowledgeable people, and also kind of demonstrate to ourselves and the people we serve that it shouldn't take so long to put solutions in place. I feel like when you look at how we work together, and I'm always tickled that people call it a system. I feel like it's really more like a gob of us that have tried to navigate. And if we were to create a system, it probably wouldn't look as cumbersome as it is right now. So if we take a systems view of what we're doing and look at what could we do to make it better for the people we serve and for our folks who serve as housing care managers or outreach folks, what could we really do to improve things, and especially reduce the time it takes to help folks? That would be a real win-win. I also think that, as I said before, we as the COC need to be able to communicate the work we do, both from the perspectives of the different agencies and the work we do as a team, to continue to help our community understand the purpose of the COC and what our focus is. When we received all the funding from the state because of COVID, I think there were people were running around with hair on fire wondering what we were up to. So rather than, let that interest kind of dwindle away, I think we ought to treat this next round of activity as chapter 2 and help people understand what we think we need to be doing differently to ensure that especially some of the most vulnerable people that we still haven't developed solutions for, that we figure out how to do that. I was in several community meetings, I'm sure you guys were too, where people said, well, yeah, you put them in hotels, but then at the end, when the money's gone, they'll just be out again. And I think none of us feel good about that. So we need to work on this. Veronica, did I do okay? Did I forget anything?
I think you did great. I just forgot to mention that we are the 3rd cohort doing this. So we have 2 other cohorts to learn from as we go forward.
Yeah.
I think just to add a little bit of data to what Jackie was explaining, in terms of room key, we have once a number of them, not a huge number, but a number of them are transitioning to home keep. So we will have about, I think, 50 households in room key, and Jackie's quite right. A lot of them are very, very ill. And it is a hard thing to figure out because you're looking for housing for somebody who's been homeless, but also is not in a strong place themselves.
When I was thinking about the housing care manager that works at Ford Street, there have been times where she was able to get somebody, an IHSS worker, and get them through like a recovery from surgery place. But if somebody's health is really going to continue diminishing, I don't know that we've put those kind of ideas or figured out what to do, where really somebody may need to be in a board and care situation, not able to live independently anymore. So understanding what the needs are so we can better address them is what we need to do.
Thank you, Jackie.
Yeah.
Are there any other announcements from anybody on the board?
I just wanted to announce that in the Ukiah Daily Journal on Sunday, we will be having our date of our HCV opening of the waitlist.
Okay, and then you're going to send out an email to partners again, Lisa, of the date?
Yes.
Okay.
Megan, I thought you sounded great on the radio this morning. Did you hear yourself?
No. I will, I guess, at some point. Thank you. I didn't blow it. That's all. As long as I didn't blow it, that's fine.
You didn't blow it.
Good.
Okay, the next meeting is going to be May 17th. That's correct, right, Veronica?
Yes, May 17th at 1:30 p.m.
And Dan, I think Denise had a question for you.
Okay, Denise?
Didn't have a question. I just wanted to mention that I have masks and hand sanitizers to give away for free if anybody needs them. And I have lots, and I have big bucket cleaners for cleaning, as well as the hand sanitizers this size. And I have lots and lots of masks. So if one of your programs need them, give me a call at 463-4700. And you can either come pick them up or I will bring them to you.
Denise, what do you mean by buckets? What kind of buckets do you have?
Let me show you.
Oh,
I think Megan's thinking the same thing. I'm
Okay.
thinking.
yeah.
Like this, and you pull out the cleaner and you wipe. So it's good for wiping surfaces, door handles, you name it, you can use it.
How many of those do you have?
Lots.
Okay, I might be in touch. Are you
Okay,
thinking
I
the same thing I am,
have
Ken?
lots.
Our new
That's
residents at
all
Home
the
Key could use some cleaning supplies, so it might be perfect for them to.
Okay, oh yes, especially for the new residences.
Mhm.
Yeah.
Yes, I have cases of the hand sanitizer. And I have lots and lots of masks.
Okay, the buckets are what I'm after, but I'll follow up with you.
Yeah, I could give you enough for each one of your rooms if that's what you need, or, and I can order more.
Okay.
All right.
Thank you, Denise.
And you said that's 463-4700?
Yes.
Thank you.
Okay, so the next meeting will be May 17th at 1:30. And there will be a doodle poll that goes out between now and then for another strategic planning committee, which will hopefully be held before the 17th. So I think we're done for the day. Thank you, everybody, for coming.
Thank you.
Thank you.
Bye.
Thank you. Bye.